My speech today is about burnout in the medical field, or specifically, that it's not burnout but moral injury. What is moral injury? Dr. Simon G. Talbot and Wendy Dean tell us physicians in the medical field today sometimes are described as being on the front lines, an apt metaphor. Often, sorry, physicians today often face a profound and unrecognizable threat to their well-being, moral injury. Moral injury is the perpetuating, failing to prevent, bearing witness to, or learning about that transgresses deeply held moral beliefs and expectations. In combat veterans, we would call this PTSD. In physicians, they give it the title of burnout. Burnout is such a lesser term than what it is. It indicates that all you need is a few essential oils and some time off and you'll be able to get over this. I've felt the effects of moral injury before I decided to go into the career path I am, which is teaching. I wanted to go into the health profession. So I started out as a CNA, a certified nurse's assistant. And I went in wanting to help. I went in with a caring heart. I went in loving my patients and not being able to care for them the way I wanted to. The residents in the nursing homes that I would take care of were sometimes in appalling situations that I couldn't get them out of. And that is what moral injury feels like to me. When you have a resident with a bed sore with maggots in it, and you have a nurse that you can't get to dress the room or clean the wound, that's moral injury. So today I hope to shed some light on the difference of burnout and moral injury. And we'll start with how many it affects, how it affects them, and then what we can do to change it. The amount of healthcare professionals that this affects is astronomically high. According to the Loan Institute, the recent survey of physicians said that 44% of physicians feel burnout. Another 78% of physicians feel the symptoms of burnout sometimes. That's almost the majority. And it's not just our physicians. I was a CNA. I was at the bottom of the barrel. So if I'm feeling this way, our nurses are feeling this way, our radiologists feeling this way, our radiation techs feeling this way, our physicians feeling this way, it's our whole healthcare system. The term burnout, like I said, it manufactures almost a feeling of victim shaming. It implies that you're not strong enough, you can't adapt to this job, and it keeps the cycle going. Now that you know the statistics on burnout, what causes it? Moral injury happens when healthcare professionals go in wanting to help and are confronted with a healthcare system that's broken. Our healthcare system is everything opposite of what we go in wanting to actually do. Whether you have to turn away a patient because of health insurance, or you're working in a nursing home that is completely messed up. Like, and when I say that, it has a set of rules and regulations that should be following, but somewhere along the way, they fell off of those regulations, and you as one person can't get them back on track. There's many situations that you're in. Money. Money is a huge, huge factor in hospitals and doctors' offices. There's cases where you can't take your patients. You can't take a certain surgery. You can't do this because it's either not enough money, or you need more money, or it's money is just the number one factor in everything. It's also extremely hard to take care of your patients the way you want to if you don't feel like your institution is behind you. As a resident, for instance, uh, Jennifer R. Bernstein wrote about her partner in a heartbreaking tale that told about him being destroyed by the one thing he loved. He was a resident, and the hours that they worked him, the abuse that they gave him, destroyed him. If you show one sign of weakness, they're on you like sharks in water, with blood in the water. And this is how we treat our people that are starting out with such large hearts, ready to help. I mean, how are you supposed to continue after that? You have to be strong. You have to be strong. I too have felt the type of exhaustion that a resident might feel as a CNA. I worked a 24-hour shift with no break. I asked my charge nurse RN if she could relieve me for at least to go eat. I was told no, because my duties were below her. And you get a lot of hierarchy in the medical field, which I don't feel is right, and will resort to moral injury in cases, because you should all work together. I mean, if you're constantly being berated by your higher ups, then it hurts your heart. So what can we do to heal moral injury? We know what won't work. We don't need Code Lavender to come in with more essential oils and more employee getaways, and that's not going to work. After reading Physicians Suffering from Moral Injury, what can we do for a solution? We need leaders that are willing to step up and fight. Our physicians need to be able to make decisions and be respected. We need to be able, leaders who recognize that caring for their physicians results in thoughtful compensation, thoughtful, compassionate care for their patients, and that senior doctors whose knowledge and skills transcend the business cycle should be treated with loyalty and not as replaceable, not put out to pasture because of the money that it might cost them. Like they're depreciating assets. And a truly free market of insurers and providers, one without financial obligations, being pushed for providers would allow self-regulation and patient-driven care. So now, knowing the difference between burnout and moral injury, I hope that can look at your physicians in the ER differently, your nurses in the ER differently when they seem to be taking forever and you're frustrated, or they look like they're dragging, because they are. They're exhausted. They probably have been berated by many, many people that day. It's not easy. Those who choose to go into the healthcare profession, I wish you all the luck, because you go in wanting one thing and it ends up being another. And if we don't fix it for the sake of our professionals and our patients, it's never going to get any better.